The statements and opinions expressed in this episode are those of Dr. Sigman and his guests, and do not necessarily reflect the views of Veradigm.
It's time to do healthcare smarter. This is Smart Medicine, hosted by Dr. Scott Sigman and powered by Veradigm. If you work in healthcare, the idea of patient-centered care is nothing new. Of course, the patient should be a part of the process. At the end of the day, it is their experience that matters most. But what if there's something even bigger happening? Because I heard a revolution is brewing, where the next great shift in healthcare is not just about putting patients at the center, but about recognizing that many of them are already out in front, pushing the system to improve in fascinating and unexpected ways. And that is exactly the conversation we are having today. What makes this episode especially interesting is that my guest is not even a physician. She's an anthropologist by training, someone who has spent her career studying human behavior, community, and how people respond when the system around them does not meet their needs. She also happens to be the former Chief Technology Officer at the U.S. Department of Health and Human Services under President Obama. Today, I am joined by Susannah Fox. In this episode, we explore what she calls the patient-led revolution, a movement driven by patients, survivors, caregivers, otherwise described as the artists, rebels, and cowboys of healthcare. Welcome to the finale of Smart Medicine Season 2. And like always, this one is all about the patients. So here's a thought. Most of us in healthcare are trained to look at data, scans, outcomes. But what if the real insights came from watching human behavior? Healthcare has traditionally been built around patients, but not always with them. And in today's world of social media and technology, she's been watching a real shift. And what has she found? That it's actually not just interesting, but it's a revolution. Susannah Fox, welcome to the Smart Medicine Podcast.
Thanks for having me.
It's a pleasure. So listen, your pathway is a little different than what we've had for most of our guests. Most of our guests are either scientists or physicians within the healthcare industry, but you're an anthropologist. You study human behavior of all things, and you've been studying people and watching how patients and caregivers navigate healthcare. So take us back to the start of this journey, how you were learning about anthropology and decided to get into healthcare. I love that pivot. Talk to us.
An anthropologist is trained to enter into a new community with respect, and to listen and learn from the people. And it's this idea of participant observation. And I loved that as a field of study. And I have found it to be really useful in my work as a technology and business strategist, because you need to listen to the customers. You need to listen to the people who are actually trying to create the product in order to understand what needs to happen next. So that's where I bring the spin of anthropology into business and into healthcare.
I mean, that's awesome. So, our kids these days just assume that the internet's been around forever, but literally it was about in the mid-90s when this great new incubator, the World Wide Web and the internet was created. And I think for you in particular, what a breeding ground to be able to see how patients and people interact and talk about behaviors as well. So that explosion of technology must have been really an important moment for you as you were sort of developing your theories about human behavior and medicine.
I was lucky enough to become a researcher in the year 2000 at the Pew Research Center, and our task was to look at the social impact of the internet. And healthcare was one of the areas where we saw a lot of change happening. And I was lucky to have a mentor, Tom Ferguson. He was a trained MD who had spent a lot of time in early internet forums. And he said, if you want to understand the future of healthcare and technology, you should go and hang out with people who are living with rare and life-changing diagnoses. rare disease is defined as something that happens only in 1 in 200,000 people. What I found is that people were pressing the edges of the frontier in terms of technology in order to try to save themselves or their children. And people were using technology in ways that people didn't expect. People were pooling data together. They were collecting their own data, even in the early 2000s. And what I observed is that it was incredibly important for these patients and caregivers to connect with each other. And so peer-to-peer healthcare. And it's the idea that no matter what you face, you are not alone. There are people who would love to help you if only they knew how to find you. And the internet collapses boundaries of time and space and allows people to find each other. And it's one of the superpowers that fuels the patient-led revolution in medical care.
I love how you sort of bring that together. And, we've had so many guests on the Smart Medicine podcast that are in the space of AI and technology. And it's just amazing how fast it's growing. Back in the day, it was you, the patient, and the doctor in the room. And the doctor, as much as you could memorize, is what you could put into your brain to help you diagnose and then treat patients. And at the end of the day, the brain only had so much capacity. It's amazing.
It is amazing. And what you're describing with that patient-doctor relationship, that is still happening. But now, because of the internet and even more because of AI, patients and caregivers are bringing in so much information and so much of their own data. And let's talk about wearables, right? So all of the data that we're collecting, that if a clinician is ready for it, can give a much fuller picture of that person's physical health as well as mental health. And so the first revolution was just acknowledging that patients can and should have access to the same medical literature that doctors have had access to. The second revolution is the idea that patients, by connecting with each other, can come up with really interesting research questions and actually pursue them together. And that can then inform science and can inform medical device innovation. And then the third revolution is AI.
Yeah, and all of those things are coming together. The vast majority of our guests are all very bullish on technology and healthcare in the future of humanity in particular. I know I am as well. I'm not a Skynet Terminator guy. So are you? So what's your thoughts? It seems to me like you're also bullish on the idea of technology and AI and communication amongst doctors and patients?
I am. And I should caveat that by saying that I think in the future there's going to be a genetic test for optimism. And my dad was actually diagnosed by his therapist, right? My dad was diagnosed by his therapist as irrationally optimistic. And so I think I inherited that. But I see in the landscape this democratization of access to data, access to information, access to tools that will allow people to contribute to solving the problems that they face, identifying and solving the problems that they face. And that's really the goal of healthcare.
Let's talk about your idea of the patient-led revolution. I really like that. So when people hear that for the first time, it seems foreign. It's a big concept. Patients have been a part of the system of healthcare forever. They're part of the conversation, but not necessarily integrated into the system. So when you say the patient-led revolution for our listeners, what do you mean?
I want to distinguish patient-led from patient-centered. There's a lot of discussion, which patients welcome, in healthcare about putting the patient at the center. The people that I hang out with, the cowboys and the artists and the rebels of healthcare, don't want to be put at the center. They want to be at the front.
I want to stop on that point for a moment because it is just as important as it is interesting. For years, healthcare has talked about being patient-centered, and that really gained national momentum in 2001 when the Institute of Medicine named patient-centered care as one of the key aims for improving quality in healthcare. But what is fascinating is how that conversation has continued to evolve. Over time, we started hearing new language popping up, words like co-design and co-creation, all pointing to a bigger idea, that patients should not simply be included in healthcare, they should actually help to shape it. And that is exactly what makes Susannah's idea so compelling. She pushes the conversation one step further. Not just patient-centered, but patient-led, supported by a healthcare system that is willing to listen, to learn, and to build alongside them. And if you're a healthcare leader listening today, that is a challenge worth championing. Ask yourselves, how do you create the conditions not just for patients to be heard, but for them to help lead? Because that may be where the real opportunity lies.
The people that I hang out with, the cowboys and the artists and the rebels of healthcare, don't want to be put at the center. They want to be at the front. They want to be asking the questions. They want to have their fingers on the keyboard. And it is challenging to some degree when you use the word rebel or when you use the word revolution. It can feel very challenging. In fact, during my book tour, a lot of people would show up at my book talk, and these were consumers, and be disappointed because they said at the end of my talk, they said, I thought that this was going to be a book about the overthrow of the American healthcare system. And it's not. It's not about the overthrow of our healthcare systems. It's about listening to patients, learning from patients, letting patients lead. And everyone is invited. This is a revolution that includes clinicians and executives and funders and even government leaders. This is a revolution for human health.
I love it. So let's talk about the framework. You talk about a very powerful framework, and you use some very specific terms, and I'd really like you to describe this. You talk about the seekers, the networkers, the solvers, and the champions. And so walk us through these roles so that our listeners understand who they are, because I think the categories are really quite fascinating, and I think you can actually be in a number of different categories at the same time, but let's share that with our listeners.
Absolutely. When I started writing the book, I looked at the 20 years of research and fieldwork that I had done, and I started discerning some patterns. And I wanted to be able to describe the power of patients and caregivers in a way that they could see their power, but also to help people in leadership to see that if they want to get the job done, they need to partner with these people. Seekers are people who sense that something is not right with their health, and they decide to go and find out information. They decide to go out on the hunt to see if they can learn more about how to describe this symptom or see if they can read up on this diagnosis that they have been told they have. Networkers are people who very naturally form and nurture communities. If someone finds out that something works, then a networker is likely to share it with a wide group of people. They're also early warning systems for crises in healthcare. It's very, very useful to partner with networkers. The third group are solvers. Solvers are people who may have had training as engineers, and then they are plunged into healthcare because of a diagnosis, either their own or a loved one. They may be systems thinkers. They may be people who tinker in a workshop. And when they see a problem, they can't help but attack it. And that can be a technology solution, that could be writing code, or it could be literally building something like an assistive device for someone with low dexterity, for example. So when I began writing, I knew that I was going to be describing these three archetypes. But then in my interviews with people where I was telling them about the archetypes that I'd already come up with and I was listening to their stories, of how they took a personal innovation and were able to commercialize it or were able to spread it further. What I heard is a fourth archetype, and that is a champion. Every single innovator that I talked with who'd had some success, they were able to name at least one person who had shared a resource with them. It was a journalist who wrote about them and they got media attention. It was an investor who recognized the genius of a patient-led team and gave them the money that they needed. It could even be a government agency who helped a team with regulatory guidance. And champions are people who hold access to power, who hold access to resources, and are always looking across the landscape for innovations that can help their business, that can help their government. And they recognize talent when they see it. And that now can be a patient-led team.
Amazing. So the seekers are the researchers. They're the ones that are looking out there for ideas. The networkers want to connect with everyone to be able to share these ideas. I sort of think maybe they don't trust the system and they want to believe in others. I think of the millennials. You've got the solvers, which are the ones that are going to take action. They're going to experience new ideas and try to build things. And then you've got the champions who are the advocates for the people who could be the voice or provide the resources so that these ideas could be shared. Really, really great anthropological ideas for us physicians out there as we're listening. So let's talk about the physician now. So I'm the brand guy. My book, Physician Brand RX, is coming out shortly. And I'm constantly pushing my physician colleagues to share their messaging and engage into this digital world. And so at this point, as physicians, I would think that we would want to communicate in a way that resonates with the seekers, the networkers, the solvers, and the champions, right? So share your thoughts on how physicians can lead in this conversation and not be left behind.
I think there is an immense opportunity for physicians because one of the first topics that comes up when I talk about patients connecting with each other is the danger of misinformation and disinformation. And those are real dangers. And by the way, misinformation is incorrect information that's spread by mistake. Disinformation, that is incorrect information spread on purpose. And we need clinicians' voices in the public conversation. We need more people who understand science using their platforms to contribute. And what we also need to acknowledge is that patients are doing research online anyway. And so why don't we help them? Why don't we make sure that they understand how to spell that drug or that diagnosis, or give them some search terms, or better yet, if you can give them some recommendations. If you are a specialist, why not create a website of sources that you trust right on your website so that you become a trusted node on the network?
Susannah is giving us such a unique lens on healthcare. What she is showing us is that these communities do not come together by accident. They find one another because they have to address a gap or need. And what emerges from that is something incredible. Resilience, ingenuity, connection, and in many cases, real innovation. That's when we start to see these archetypes come together and push for better care in ways the traditional system may have missed. So what does this actually look like in the real world? What happens when a patient community, a company, or a team truly gets this right? That is where we are headed next, and you're going to want to hear the examples Susannah shares. First, this episode of Smart Medicine is powered by Veradigm. Veradigm connects payers, providers, and life sciences through data-driven insights that make healthcare smarter. So we've talked about physicians. Now we've talked about some patients. You've mentioned industry and companies. So let's talk about some consumer-facing health companies, right? Now they're delivering concepts and ideas. They're helping to shape behavior. Can you talk about some companies or products that you think are excelling in this space? And what platforms are they using for our listeners to identify with?
I love to talk about diabetes as an area, as a bright spot in the patient-led revolution, because medical device companies throughout the 1990s were developing wonderful new devices, the continuous glucose monitor, insulin pumps, but they did not see the opportunity of patients having direct access to the data that was being generated by their own bodies. And by the way, as I'm talking about diabetes, think about all the other devices that someone might be prescribed and someone might use, and that currently the data only goes to a doctor's office, which was the default setting for continuous glucose monitors. Well, parents of children with type 1 insulin-requiring diabetes were really frustrated because if they wanted to make sure their kid was doing okay in the middle of the night, they would have to stumble down the hallway and peer through the darkness, hoping that their kid didn't wake up, to look at the screen of the kid's CGM. Now, again, the CGM is a miracle, like totally awesome that you wouldn't have to do a blood test in the middle of the night. But one dad, John Kostick, realized, because he's an engineer, he was looking at his kid's CGM and he said, "What is this port? I think I could get access to the data." And so he hacked into his kid's CGM, freed the data, sent it to his Apple Watch. So at least in the middle of the night, he could just stay in bed and look at his own Apple Watch to see that his kid's data was trending okay. And he could go back to sleep a little bit more easily. Well, he shared how he did that on Twitter, and it set off a cascade of innovation. Many parents and patients all across the world started copying his recipe, essentially, for data access. What I love about this is that at first the FDA said, "Hold on now. What are you doing with these medical devices?" But the patients made the case. The patients said, if you're concerned about safety, you know what's really dangerous? Living with diabetes and not having access to our data. And the medical device companies also at first were very taken aback, but have since embraced this as a new market differentiator. And now the default is that patients have access to the data that's being generated by their own bodies. And it opened up a whole area of new products, new market differentiators in medical devices, in diabetes. And once again, patients are leading. Patients have actually created an open source artificial pancreas system using a little Raspberry Pi processor that links up the CGM with an insulin pump with medically created algorithms.
Literally real-life example of that in my office yesterday. I had a 35-year-old woman with a pending frozen shoulder who was diagnosed with type 1 diabetes at the age of 13 and walked in with her devices, as you're just describing, with an A1C of 6.1, who we are going to save her life. She's not going to go blind. She's not going to develop multi-organ failure at such an early age. This is profoundly important in the development of healthcare. So can't agree with you more on that very bright spot in healthcare. Thank you. Let's talk about the blind spots a little bit too. One of the things that you really discuss is the underserved. You talked about diabetes, other chronic diseases. We could talk about nutrition, perhaps even mental health. We talk about food deserts and surgical deserts around the world, where here we are in this beautiful, great country of our own here in the United States, much less the rest of the world. There truly are blind spots depending on your zip code.
When I was writing the book, I wanted to provide a lens that would make sense to both patients and to government and industry leaders. so that they could see what I see. And that is when someone feels that their needs are not being met by the healthcare system and they feel invisible, that is just a state of suffering. And if you are a clinician, it's an area that you want to dive in and help them, but you might not have a lens that helps you to see that. One reason I wrote the book was because I wanted to introduce these two groups of people that I hang out with to each other. I hang out with these rebel patients and survivors and caregivers who are building amazing things. But I also hang out with people who work at the top of the federal government, at the top of, major medical device, health insurance, pharma corporations, as well as with clinicians. And they don't see each other yet as allies, and they really should. I want people to know that the suffering that patients are feeling can be alleviated if we can recognize, if entrepreneurs can recognize that there are huge markets that are available for innovation. And there are ideas that are just not being developed because a patient may not have the wherewithal, they may not have the funding, they may not have the clinical expertise to test their idea. And so that's what I really am passionate about, is making sure people understand that amid all the suffering, there's also opportunity.
I can't agree more. I think that in particular, that's where technology and the cross-pollination that we're seeing with these brilliant people in Silicon Valley and around the world that are doing amazing things. And then we put them in the room either with patients in these chronic ailments or with physicians that have unique ideas, and then innovating in a way that truly will help the human species. So let's do a little sort of real world action here. I am also the chief medical officer and founder of OrthoLaser Orthopedic Wellness Centers. And we use the power of light to create healing. So I want to bring this patient experience into how I deliver the care. I want to know how to design our centers so that people want to become a part of it. So where do I start? How do I find the patients? How am I building real trust to create mutual value? And then how am I going to share that with the seekers, networkers, solvers, and champions to make my business successful?
Well, you can start with your current patient population, and you can begin by talking with patients in a different way, by acknowledging that they may have searched online. And you can say, when you look online, what are the search terms that you use? When you have found useful information, where was it? It may surprise you to learn how much people are relying, for example, on Reddit for information, counting on the user reviews of people that they don't know, will never meet, but are counting on that advice in open forums, whether it's Facebook or Reddit or elsewhere. So you can do some market research by talking to your current patient panel about where they are getting information and where they are connecting with other people. You can also ask them, have you ever talked with someone else who has the same symptoms or the same diagnosis? And you can start to see how many networkers you have, people, because it's actually kind of hard to do. It's hard to figure out where to find someone who has the same diagnosis. You might also make your waiting room attractive enough that people come early, where they can do their own research. And if they're extroverted like me, and I suspect you, they might start talking to fellow patients in the waiting room. And you might create a more social atmosphere and create a real world forum where people can start to talk to each other. And you would learn from what they are talking about.
Now, how about my physician colleagues who may be skeptical about a new technology that has not been taught to them in their medical school? How do we break into that world to be able to convince them of our excellent outcomes?
Well, peer-to-peer learning is something that originated in clinical training and clinical practice. And it's what I borrowed for describing how patients learn from each other. So I believe that the same dynamics can be true, where you ask clinicians, where do they learn about new technology? And by asking that, it might expose that they're not learning about new technology. And you need to figure out how to ask the question so that it's not embarrassing if they don't know. But finding out, are they doing any research about new technology? And if not, maybe you could help them and not only promote your new technology, but talk about other examples of new technology.
That is very sagely advised, because oftentimes these new technologies actually are synergistic with one another. So being an expert in many new concepts and ideas allows for a more open forum to discuss. Let's provide some real life advice to our listeners out there that are ready to start up and try something new and different. What would you say to them?
I would say be useful. If you are entering into a community or you're already part of a community and you want to have more influence, find ways to be useful. Surface the information that people need, and they may not know that it exists yet. They may not even know that they need it. But if you are useful to your community, that will help you spread the news about new technology.
Susannah, it's been such a privilege to be able to share your story as the closure of season 2 of the Smart Medicine podcast. And as we look forward to season 3, can you give us your definition of what you think smart medicine means to you?
Smart medicine acknowledges that patients, survivors, and caregivers know things that academic literature and clinical expertise do not know. And smart medicine is a partnership of all the stakeholders working together.
Susannah, this was really enlightening. I really enjoyed our conversation today. Just wanted to say thank you very much for allowing us to look at healthcare through your human lens, which is really quite unique. It's been a pleasure having you on the show.
Thank you.
Susannah really could not have given us a better end to season 2. What resonated most with me is this: we should not start with the patient just because they're receiving care. We should start with the patient because they often see what the rest of us and the system cannot. Patients, survivors, and caregivers have a lens into the blind spots of healthcare that organizations, institutions, and even experts may miss. Because when we truly listen to the people closest to the problem, that is when we unlock what smarter care can really be. That is how we get to smart medicine.